Hey guys, a very beautiful morning, beautiful afternoon, and beautiful evening to every one of you, my professional nurses, great nurses, articulated nurses. How are we all doing? How is preparations going for our exams? Definitely, guys, keep studying, and you're definitely going to be successful. All right, guys. I lack words to express my feelings this morning. Should I say I'm super elated? No, I use my usual words. I'm super excited. Guys, you wouldn't believe it. I will tell you I'm motivated. That's the exit word. Yesterday was massive. Yesterday was massive. Too many messages yesterday. I can't count. It's uncountable. Those who took the whole test of competencies, you need to see my emails. I'm like my what do you call it? My megabyte or what do you call it? It's filled up. You need to see the messages. Thanks, I passed my OSCE. I passed my OSCE. Old test of competency. I got more than 17 messages for the old test of competency yesterday. All passes. I got for the new test of competencies 8 messages, those who took the new test of competency. And guys, I'm super proud of every one of you. In fact, more than the sky is your limit. Nurses are truly brilliant and intelligent people. I can't express how I feel. I'm so motivated that when I woke up this morning, I said I'm going to drop 5 videos today. I'm going to do a video on planning. I'm going to do a video on professional values. In fact, just expect wound assessment. I'm doing all of them today, all because of how people are passing. It's motivating me, and I want to beg every one of you, share my videos with your friends preparing for OSCE exam. In the midst of all that yesterday, I got somebody who had issues with pain assessment. That's one of the most, in fact, that skill, you just wake up and write it. So simple. But you know, if people don't have the knowledge of this, a lot of people don't have anybody sponsoring them for their OSCE exam. Some don't even have money to pay tutors to teach them. So some relies on videos. So if you have anybody preparing for OSCE, share videos to them and let them have an idea. And she was like, if I had just seen that video, just had an idea. I said, anyways, it's just advancement now. You can go on YouTube and check on anything you want and you see. So let's keep sharing videos that are very useful to our professional colleagues. All right, guys. So if you had the old OSCE or you knew OSCE and you had any issues at all, please don't let it weigh you down. Because I had someone who about 2-3 messages yesterday of people who had little challenges with their OSCE exam. I like to let you know you are also a star and you're definitely going to pass. All right, guys. So don't let that weigh you down. All right. So today, guys, I'm doing a video on new test of competency planning. If this is what you want and if this is what you like, sit back and watch to the end because I'm going to be sharing some salient points. All right, guys. And if this is your first time of watching me, my name is Violet Okolocha. I talk about everything about OSCE and nursing here in the UK. So I'm actually a nurse and I practice here in the UK as well. So guys, let's get started. So planning in the new test of competency is 14 minutes. 14 minutes. And oh, sorry guys, before we start, I actually have done the video on day 2 study with me. That video is over 59 minutes. It's not uploading. I've tried all I could and I'm not very good with the internet. If you see my videos, you know I'm still learning when it comes to quality and the rest of them. So I'm not very good with it. I've tried all I can. That's why I've not done day 3. I'm like, if you don't do day 2, how can you do day 3? You know what I mean? So just bear with me. My son has promised to help me. So I will just try and push him more so that he can help me as soon as possible. And I hope he's successful in helping me so that I can upload that video because it took me a lot of time and energy in doing that video. You can't imagine a video that is over 59 minutes, so you know how much input I've put in for it. So I really apologize for not dropping that video. So back to our planning, new test of competence planning. This planning is 14 minutes. 14 minutes. And if you ask me, the planning in the new test of competency is even much more easier than in the old test of competency, if you know what I mean, because in this planning is just 14 minutes, and trust me when I tell you, you are going to finish before time. So what is required of you in this planning? You have to identify 2 relevant nursing problems or needs. Now, for you to understand properly, I've done a video on A to E assessments. Check out that video. After watching that video, you are going to see that from that video, can you give me 2 nursing problems? Yes, the first nursing problems depends on what the assessor wants from you. Do they want you to give pre-operative or post-operative? Now, let me be your assessor for this study. I want you to give me 2 pre-operative care plans. So go watch my video on A to E assessment and give me 2 pre-operative care plan. So the first one I would love to use is Mrs. Ailey is having pains with a pain score of 7/10 due to appendicitis. And once you've given that nursing problem, the next thing, I'll show you the planning in a minute. Everywhere is so scattered, and I'll show you the planning in a minute. So this is the planning for your new test of competency. I actually hope it's clear enough. The first thing there is, this page is not a required element, but it's for use in case of error. So I will advise you, don't ever use that page, that top. Then the second thing there is nursing problem / need. So what is our nursing problem? I said Mrs. Haley is having pain with a pain score of 7/10 due to appendicitis, or Mrs. Haley is having pain with a pain score of 7/10. Now, what would be our aim of care? To be honest, I'm a nurse, but I don't like speaking English. English is not my language. Even if it's my language, I don't like speaking English. So I will always use for my aim of care, Mrs. Ailey will verbalize his of pain, but there are nurses who are professors. There are nurses who are PhD holders. They will say, aim of care, Mrs. Ailey will experience his of pain. They will not like it. They will say it's too simple. So some will say Mrs. Ailey will verbalize relief of pain with a pain score of less than 2 out of 10. So you see the difference. If you use Mrs. Ailey will verbalize a pain score of less than 2/10, is a tick. If you use Mrs. Ailey is going to verbalize ease of pain, tick. So that's all. And the next one there is re-evaluation dates. I hope it's clear enough. Re-evaluation dates. So for pain, I would advise to be evaluated after 30 minutes, every hourly, and or as the clinical condition changes. But don't worry, I'm going to be popping some care plans very soon, so just gradually understand it. So that is the reevaluation date, to be reevaluated every after 30 minutes, because if you give a drug, you have to check the effect of that drug in the next 30 minutes. So to be evaluated after 30 minutes, every hourly, and or as the clinical condition changes. All right, so then the next thing you can see is nursing intervention. Nursing intervention, can we see it clearly? Nursing intervention. So this is the planning for the new test of competency. If you look at this properly, there is no self-care. Did you take note, guys? Unlike the old Osce, you had self-care activities, but in this new Osce, there is no self-care. Take a look at it, guys. There is no self-care. It's just nursing intervention. So what are the nursing intervention that I want you to write? Ematarid. I have a video on ematarid. I will drop the link in this video because I've explained thoroughly on that video. So for ematarid, nursing intervention, let's bring up ematarid. Explain and discuss all aspects of care to patients and gain consent for all interventions. That is for E. Ematarid, EMATARID. Monitor and record Mrs. Ailey's observation. Now, how frequently do you monitor and record observations? It depends on the news. As far as I know, and at present, for the assessment, A to E assessment, they've been using the news charts. We will keep checking and make sure we are updated with the latest. You know what I mean? So for now, they're still using the news chart. So monitor and record Mrs. Ailey's observation. How often? It depends on the news score. If your patient is having a news of 0, how often do you monitor? Monitor and record Mrs. Ailey's observation 12 hourly, right? And escalate as per news 2 policy, because she has a news score of what? Of 0. What if she has a news score of 1 to 4? Like the patient I use, I think she had a news score of 2. I can't remember. If she has a news score between 1 to 4, you don't need to cram anything. It's there to be given to you at the back of your news chart. So if the patient is having news of 1 to 4, it falls between 1 to 4. How frequently do you monitor? Monitor Mrs. Ailey's observation 4 to 6 hourly and escalate as per news 2 policy. What if the patient is having a news of 3 in a single parameter? If it's having a news of 3 in a single parameter, maybe in respiration, she's having news of 3. On that respiration alone, how do you monitor? Monitor and record Mrs. Ailey's observation hourly and escalate as per news 2 policy. I actually did a video, and in one of the comments somebody said if it's news of terror you don't monitor 1 hourly. That's the standard. You monitor hourly if the person is having news of terror in a single parameter. Now, if for any reason at all you don't understand this video, you don't understand all I've said, guys, I know that I may not be replying to mails regularly, but try me on my Facebook. You can add me on Facebook or add me on Instagram. I try to answer. I'm not saying I'm perfect, but I try to respond to mails, because to be honest, the reason I'm doing this video is anybody coming to the UK, I want you to pass your Osce as first started. So if for any reason you don't understand anything I've said, don't worry. And there's no shame. Even on this my YouTube page, put it, I don't understand this, I will try to explain. And if I don't try to explain, just bear with me. It's just because of pressure of family and work. I will still definitely respond. Okay. Now, if the person is having news of 5 or more, monitor and record Mrs. Ellie's observation hourly and escalate as per news 2 policy. If the person is having news of 7 and above, monitor and record Mrs. Ellie's observation continuously and escalate as per news 2 policy. That's all. So that's all about the monitoring. It's according to the news score you have that tells you how often you should monitor. And this is not what to cram. It will be given to you. All right. And the next one is what? Ematarid. I've forgotten. A. Assess Mrs. Ellie for any signs of pains. Or assess Mrs. Ellie for sign of pain using the pain score of 0 out of 10. I'm dropping the link of my ematarid so that you understand it. After doing assess, ematarid T. What do you teach a patient in pain? Teach Mrs. Ellie diversional therapy, teach Mrs. Ellie deep breathing exercise, you know, just to what? For pain. So teach Mrs. Ellie diversional therapy, like watching of TV, teach Mrs. Ellie deep breathing exercise. And after you do teach, the next thing is what? Is A, administer or prescribe analgesic and monitor its effectiveness after 30 minutes. And that was why if you see our reevaluation date, I said to be reevaluated after 30 minutes, hourly and or, because after giving your drug, you have to evaluate the person after 30 minutes. After A, ematarid, the next thing is R, refer Mrs. Ellie to pain assessment team, or to manage the pain. And after that, the next thing is what? I, inform Mrs. Ellie to use the call bay. And the next one is what? D, document all care as what? As planned. Now, what do I advise for your Osce? For Osce, I always tell all my students, all my subscribers, all my nurses, I say to you, do emata. You know what I mean? E, explain and discuss all aspects of care, monitor and record Mrs. Ellie's observation, assess Mrs. Ellie for pain using the pain score, teach Mrs. Ellie diversional therapy and deep breathing exercise. And what is the arrow? Refer Mrs. Ellie to what? To the pain management team. Stop there. Stop there. Write your name. Write your nurse's signature. Write your dates. And go for nursing problem 2. Do we get the check? If you've written up to ematarid, as you finish writing refer, you can stop there. Even if there's space for you to continue, stop there and go start your number 2 planning. Go your number 2 planning, finish your number 2 planning at refer Mrs. Ellie again. After you finish, make sure you sign, make sure you write your name, make sure you sign, and make sure you write dates. And if there is time, you complete what? You complete I and D. What is I? Inform Mrs. Ellie to use the call bay, and D, document all care as planned. That is my best advice so that you can manage time. But if you are very fast, you know yourself, you're very fast, you can just complete the complete ematarid. Write your name, write your signature, and put your date and go to number 2. And what do I always advise? Before you start your planning, write your name. Before you start, as they give you this planning paper for exam, before you start your planning, write your name. After writing your name, write your signature, write your dates. Turn again, turn to the back, write your name, write your signature, write your dates. After that, you write your planning. After writing your planning, you stop at ematarid, which is refer. Immediately you finish writing refer, go to number 2 planning and write up to refer. After that, if there is still time, you just go and add I, inform Mrs. Ellie to use the call bay. D, document all care as planned. Because I've seen guys, I've seen somebody who went back to write Osce exam just because she forgot to put a signature. I'm not joking. She sent me the results. I'm not joking. She sent, as in when I was like, I'm not joking. So every aspect of Osce exam is to be taken seriously. Don't say, not be planning. You have to take it seriously, because I want you to pass and I want to congratulate you. So make sure on the day of your exam, as they are giving you the planning, go ahead and write your name, go ahead and write your signature, write your date on both of the papers for problem 1 and problem 2. After doing that, write ematarid up to arrow and go and solve the problem 2 up to arrow. Then if there is still time, you write I and D. So like I said, this plan is 14 minutes. Make sure your handwriting is very clear. Make sure your handwriting is very clear. And please, don't use abbreviations. Instead of writing Mrs. Ailey, you write, instead of writing patient or Mrs. Ailey, don't use abbreviation. I would not support what? Abbreviation at all. And use professional terminology in planning. What do I mean by professional terminology? Explain and discuss all aspects of care to Mrs. Ailey and gain consent. That is professional what? Terminology. Don't go and use anything that is not professional for your what? For your planning. Don't abbreviate. Don't use what? Acronyms. Endeavor to make sure you do what? You give 2 relevant nursing problem. You give 2 aims of care. Like I said, the aims of care is very simple, but I'm going to be dropping a lot of plannings very soon. So just keep up. And what if you make any mistake? If you make any mistake, just strike through like this. Strike through like this. That's it. Don't make the planning like when the examiner is marking, he or she is confused. Just strike through if for any reason you make what? You make any mistake. All right, guys. So, guys, that's all I have for you about planning in the new test of competency. And there is no self-care. There is no self-care. So, it makes the planning even easier and, easier for you to pass. So guys, thank you so much for watching. Don't forget to share this video with your friends preparing for Osce exam. I will see you in my next video on professional values and wound assessment. And until then, keep passing your Osce exam. I love you all, guys. Bye.